not required. You can start. Okay.
Okay, all right.
So this is actually a telephonic call. Okay.
Okay.
As arranged an appointment on the phone. I forgot that.
इसकी जाके ट्रेनिंग होगी ना
Sorry. So I'll be muting everybody else. Okay, Dr. Chansu, you can unmute yourself. Okay. So when you're ready, you let me know.
Okay.
So before every station, if you are new to the exam, okay, those who are new to the PLAP exam, so before every station starts, you get like 1.5 minutes to read the station and make a structure in your exam. Okay, so try to pay as much attention, try to think clearly and make an approach in your mind. Try to visualize how the patient will be sitting inside and how the patient will be behaving. Okay, so that is what I used to do. I used to visualize in my mind, okay, the patient will be doing like this and he'll be doing. So whenever you visualize in your mind kind of, is prepared to handle the situation. So that is very important. Visualization and imagination, like how things are gonna be in the station, okay? And you should have a clear approach. If you read really well before the exam, if you prepare really well, then you can also actually, because most of the stations are from the scripts, you can kind of, even like uh, even kind of think about the concerns that might be asked from you, because most of the things are from the script. Okay, so with this note, let's start.
Okay.
Begin.
Hello, my name is Dr. Jansu. I'm one of the junior doctors in the GP surgery. Can I confirm your name and age, please?
Yes, doctor, I'm Anna. I'm 16 years old.
Okay, Anna. So if the phone disconnects, can I reach you from this number again?
That's right.
Okay, can you confirm your address for me, please?
It's 123 Hardman Square.
Okay, thank you, Anna. So how can I help you?
Well, doctor, like, I don't know. My mother asked me to arrange this appointment. Like, I'm fine. Like, I don't have any issues at all, actually.
Okay, I understand. Sometimes mothers can be a bit overwhelming, but so what do you think she thinks your problem is?
I don't know. Like, she's just concerned because like I have been vomiting lately.
Okay, I see. So can you tell me more about the vomiting?
Yes, it's like I just sometimes throw up. Like, why? Like, anybody can vomit, right? I don't know what's the big deal about it.
Yeah. I understand. I understand your feelings. So can you tell me when did this started to happen?
Yeah, it's been 8 months now.
8 months. Okay. And how often does it happen?
Almost like maybe once or twice in a week.
All right. And is there anything specific that happens that could trigger this?
No.
Okay. Is there a specific time that happens?
Sometimes like if I eat, sometimes after eating food, it happens.
Okay. I see. And does it? Is there anything that makes it worse? The feeling of vomiting?
Not really. Like most of the times, when I put my hand into my mouth and it kind of
Okay.
happens that time.
Okay, so do you feel nausea?
Yeah, I feel nauseated like when I kind of induce it by putting my fingers into my mouth.
Okay, so you don't feel nauseous beforehand, is that correct?
That's right.
Okay, okay, I see, Anna. So other than the vomiting, have you or your mother noticed anything else?
No.
Okay, I'll ask some questions. Tell me yes or no.
Mhm.
Have you noticed any fever?
No.
Okay, any tummy pain?
No.
Okay, any changes in your bowel movements?
No.
Okay, any pain while urinating?
No.
Okay, any chance you could have hurt your head?
No.
Okay, thank you for answering those questions, Anna. So, do you have any medical conditions?
No.
Okay, do you use any medications, any supplements, any herbal remedies?
No.
Okay, any allergies?
No.
Okay, all right. So how has been your mood, Anna?
My mood is okay.
Okay, can you score it for me from 1 being lowest and 10 being highest?
Uh, yeah, it's like around, sometimes it is around 4, sometimes it's around 6 or 7.
Okay, okay, I understand. And who do you live with, Anna?
I live with my parents.
Okay, how is your relationship with them?
Yeah, it's okay. They are just like, sometimes they interfere in my life too much. Like they, when they, like, they don't understand my feelings. Like I keep on telling them that I'm really fat and I want to lose weight, but they seem to be
Okay,
ignoring it, and they don't understand my feelings.
okay, okay. And how long have you been feeling this feeling that you are fat?
Almost 1 year now.
Okay, and do you have a reason that why do you feel like this?
Yeah, like I am fat. Whenever I look at myself into the mirror, like I don't like myself. I want to be slim.
Okay, and is there anyone around you at school that has like similar feelings or anyone that you look up to?
I look up to. I have a role model, Angelina Jolie. I want to be like her.
Okay, I see, Anna. So do you think this inducing vomiting is causing you problems?
Not really. I think it's fine. I think it's really healthy for me. It keeps my weight in check.
Okay, do you think you need help for this?
No, I don't think I need any help for this.
Okay, I see, Anna. Have you noticed any heart racing?
No.
Okay, any weight loss?
2 minutes remaining.
Okay, so Anna, what I would like to do is I would like to arrange an appointment with you for you to come to the surgery so that we can do your examinations, and we might also like to do some blood tests too. Is that okay?
Okay. What all examinations?
Oh, okay, so we would like to do, Anna, your general physical examination, your vital signs, which is your heart rate, your breathing rate, your saturation, blood pressure, and temperature. And we would also like to measure your height and weight and calculate your BMI.
Okay, BMI is
Uh,
22. Vitals are normal.
your BMI is
22.
22. Okay. So, Anna, do you have any expectations from me regarding this consultation?
Not really. I don't have any issues.
Okay, Anna. So from what we talked about and from your history, you seem to be having a condition called Bulimia nervosa. Have you ever heard of it?
No. What is that?
So sometimes a person can have different feelings about how they look, and in order to look thinner, to make themselves more comfortable, they can make themselves sick, or they can really be strict about their diets and exercises.
Okay. Okay.
Okay, so inducing vomiting can cause issues for your health, really serious issues. So what I would suggest is I would like to refer you to a local eating disorder clinic so that you can... okay.
Move on to the next station.
Okay.
Okay. What do you think?
Me?
Yeah. Yeah.
Okay, I took very long. I didn't ask diet, I didn't ask exercise.
Mm-hmm. Okay.
If I had a couple of, like 1 minute, maybe I could have finished.
Why do you think you lost the time? Where did you lose the time?
I don't know, maybe I asked too much red flags and...
Yeah, I think medical history was too long. Okay, that's one reason. Okay. All right. And also, I think when patient was trying to give you some hints, when patient was telling you that I'm inducing vomiting, you didn't really, explore it, like why you inducing vomiting. You kind of, you were just going by the script. You didn't really follow the cues. I was telling you that I have been inducing vomiting. You should have asked why are you doing it? From there on, you could have figured out like the history of eating disorder. So I think you lost time because you just wanted to ask a set of questions. All right, we will come to that. Let's take a feedback from the doctors who have been listening. Anybody wants to say something?
Hello.
Yeah. Go on.
Actually, in the vomiting, I think she should have followed the track. Like she did not ask about the color of the vomiting, content of the vomiting, and other than that, she did not ask about the weight, and also, yeah.
Okay.
Otherwise, it was fine. Yeah.
Okay. All right. That's good.
Can I add something in that?
Sorry.
Yeah, I want to add something in that. I guess, yeah, the weight should be asked earlier, other than the other stuff, like any the yes or no questions. His medical history was a bit long. Yeah, maybe we should have come straight to the weight.
Okay.
Also, when the BMI was asked and it's like 21 or something, then we should have reassured her that the normal body mass index or BMI is in between 18.5 and 24.9. So you have a very average weight. So, but like we have to reassure the patient that there is nothing wrong with your weight. But maybe sometimes there is wrong what you think about your weight. So you have to.
Yeah, and one thing I think, if the patient is 16-year-old, and she should ask about the menstrual history as well.
Okay. All right. Okay. So what else? What else? Anybody else want?
Yes. Consequences of vomiting, like complications.
Okay.
Because that requires urgent admission if there are any complications, like palpitation or fainting attacks.
Okay. I think she did ask some heart racing and something. She did ask that.
Okay.
All right. That's good. Anybody else wants to say something?
Her relation with her mother should have been addressed. She said it twice that my mother is concerned about me, and then again the patient repeated that they too much interest in my matters, something like that. I think it should have been addressed. Something like this should have been said that they are caretaker or something like that would have been said there.
Yeah, I did feel when I told about my story that my parents are like this and that. So she kind of just moved on to the next thing, didn't acknowledge at all. Did acknowledge in the beginning when I told my mother is concerned. So she did say sometimes parents can be, I don't know what something she said. But later on, when I told her about my story, that my parents are bothered about my weight and stuff, she didn't really acknowledge it and she moved on. So I think IPS somewhere it was, lacking. And you lost a lot of time because, so in the beginning, when I tell you the presenting complaint that I have vomiting from 8 months. 8 months is a long time. Like you not asking 8 months, that's a long time. Like, have you done anything about it? No, nothing was asked. Have you done anything about it? Any particular reason it's been happening? Do you think? How are you coping with it? So it's like very natural for you to ask. Somebody's vomiting from 8 months. Okay, not from 2 days, from 8 months. It's a very long time. So you need to ask. Okay. So that was not done. So a lot of questions would have, answers would have come if you did ask, did ask some open-ended questions in the beginning. So then coming to the vomiting, you did explore like anything makes it better, anything makes it worse. Okay, that's fine. Any particular time of the day it happens, how many episodes, all these things. So that was good. Little bit 40 para is great. But you should ask about vomiting, like what is the color of the vomiting, what is the content of the vomiting. Then little bit about some other gastroenteritis, like any tummy pain, any loose stools. That's all. Don't go into too much detail because it's been happening from 8 months. So when she's telling you that I have been inducing vomiting, I have been putting my hands into my mouth to induce vomiting, you need to ask like, why are you doing it? Is there any particular reason? Okay, then she might tell you, okay, doctor, actually I'm not happy with my weight. I want to lose weight. Okay, then you should ask like, what is your weight? Why do you want to lose weight? Okay, like you should ask, has anybody told you anything about it? Then you should ask about SCOP questions. You didn't ask that also. So SCOP question is S. Do you feel sick? Do you eat so much that you feel sick? Okay, have you lost control of how much you eat? And O is, have you lost weight recently? Then F is that food dominant your life. And last F is, do you think you're fat when others think you are not? So SCOF was not asked. If not all of it, at least you should ask about binge eating. Binge eating was very, very important. If you don't ask binge eating in bulimia, that is blunder. Okay. So you must ask binge eating. And by any chance, if she is not telling you, you should ask, by any chance, do you feel like you eat so much that you feel sick? Okay. I did mention you that I feel sick like sometimes when I eat food. So you need to ask, like, do you feel sick? Like, do you feel like you eat a lot more than, that you feel sick? So that was not asked. So that would have been enough to rule out, rule in the eating disorder part. Then coming to the psychiatric history. So psychosocial history. So how is your mood lately? That can be asked separately. So psychosocial history includes mood, then family, friends, relationship. How are you coping with everything? Have you shared this with anyone? Okay, little bit about that. Any suicidal thoughts? I did mention my mood is sometimes 4. You didn't really acknowledge that also. So a lot of things you just kind of overlooked. And then a medical history. So medical history, you did ask the differentials and stuff, but you didn't ask about periods. Okay, and you didn't ask about any anemic symptoms. You did ask heart racing and stuff, so that's good enough. Then you should also ask about diet. What do you eat? So you must, in eating disorder question, you must ask them to elaborate their diet. What do you eat in the morning? What do you eat in the evening? What do you eat in the night? Can you please tell me your eating schedule? Or can you please give me a recap of how do you eat? Or what did you eat today? Or yesterday, what did you eat? Can you give me a recap? That is very important. Okay. Then moving on, so this is the history. So first part is vomiting history, little bit about the differentials and complications. Then moving on to the history of the SCOF. Okay, so you should move to SCOF as soon as possible in this station. You didn't at all. That's why you lost so much time. Patient is clearly giving you hint of eating disorder. In anorexia, they may not, have any insight, but in bulimia, they might tell you. And so you need to ask SCOF, binge eating specifically. Then moving on to MC famship, a little bit mood. Okay, that is psychosocial history basically. Then after psychosocial history, you can ask about some other related medical history. That's it, and diet. Then examination also, I need to examine you. So you should always tell that I would like to check your vitals, your blood pressure, this, and your BMI, your body mass index, in which I will check your healthy weight for your height. Okay. Then I would like to hear your chest for your heart and your lungs. So all these things you should mention, and head to examination also. Then eating disorder. So when the BMI is 22, you should tell that normal BMI. So your BMI is 22, which is pointing that your weight is normal. Okay, in this condition, I'm suspecting that you are having an eating disorder called bulimia nervosa. Have you heard about it? So it is a condition when you feel that your weight is in the higher side, even when it is normal. That's it. Okay. So then she might say something, then the management. So I will refer you to the eating disorder unit, and we will arrange a face-to-face appointment. Okay. We need to check you. We need to examine you. It's very important because sometimes it can lead to complications. And we will also refer you to a child and adolescent mental health team. Okay. And we will refer to a counselor. Talking therapy will happen there as well. And we will also refer you to a dietitian for a healthy diet plan and some make sure that you're eating healthy food. Okay. And then we will follow you up within 2-3 weeks. And if the mood is low, crisis card, and the family issues are there, so family therapy has to be offered as well. Okay. And advise her to rinse the mouth after vomiting, as sometimes acid will affect the mouth and teeth. And also check her hands, specifically hands, for Russell sign. Okay. Because the knuckles can get swollen because of excessively inducing the vomiting. Okay, so that these all things are important. So overall, what I think is that you did ask about your medical history was still fine, like your differentials, complications, it was okay. But your eating disorder history was very bad. You didn't ask of. Okay. Psychosocial history was okay. You did ask about mood, family, friends, but eating disorder unit, which is the most important thing, was totally missing. And IPS was also not up to the mark. You didn't acknowledge many times, and when the patient is saying something, so you need to work on that. And the management, the diagnosis, you didn't explain well. Okay, you didn't relate the BMI with the condition, and of course time management was bad, and you didn't complete the management at all. So to improve yourself, you need to quickly ask the eating disorder questions, and moving on to vomiting to eating disorder questions, you need to figure out that, and quickly ask psychosocial history as well. Okay, and work upon the management. Any questions?
Okay, thank you.
Okay, you're welcome. Any questions, anyone? Okay, let's look at the comments. So we need to take focus history.
Yeah, I have a question. So about the crisis card.
Okay, go on.
So like, in which situations is a person gets a crisis card? In mental health conditions, and some in other situations as well?
Yes, any mental health condition or eating disorder unit can also lead to low mood. So whenever there is low mood, you can offer crisis card, or whenever there is some mental health condition or some other unusual conditions like LGBTQ, where they can be a harm to themselves. So you can offer crisis. Okay, any questions, anyone? All right. So overall, in eating disorder unit, there are two questions. One is anorexia, one this is bulimia. This is also common station these days. Like every week, it's coming once. So you should ask about SCOF. Okay, SCOF. People are asking what is SCOF. So S stands for sick. Like, do you drive yourself? You eat so much that you feel sick. Okay, like binge eating. Okay. C stands for control. Have you lost control on how much you eat? O stands for have you lost weight? Oh, stones. Okay, have you lost weight? Like I think there is 2 stones in last 2-3 months. I don't clearly remember the figures, but there is loss of weight. And F stands for food. Does food dominate your life? And last F stands for fat. Do you think you're fat when others think you're not? If one or more than one is positive, that means it's a eating disorder. Okay, so you can again look at the criteria on NHS. More than 1 stone in 3 months. That is what Dr. Nitya has written in the chat. So that is the criteria, and 1 stone is 3.5 kgs. Okay. So this is very important. Then other questions that usually are asked in eating disorder is like, how do you see yourself in the mirror? What kind of clothes do you wear? Do you have any role models? So these are the questions also which might point you towards eating disorder. Okay. They might wear baggy clothes. They might see themselves fat in the mirror, or they might have some role models. Okay, you need to ask these questions. And diet and exercise also very important. That was not explored. Exercise, I forgot to mention earlier. It is very, very important as well. So there are a lot of questions, and at the same time, some medical complications. So you need to be a little more quick in this. Okay, let's move on to the next case. If you don't have any questions. Anyone, any questions before we move on? Okay, so we will give option to Dr. Samra because her exam is on 1st June, and she hasn't performed with me before. So are you there, Dr. Samra?
Yes,
Okay.
doctor, I'm there.
All right. Okay. So next station will appear on the screen now.
Okay.
Begin.
Hello,
Hello.
I'm Dr. Samra, one of the junior doctor in this department. May I confirm your full name?
Yes, doctor. I am Sarah Parker.
Okay. Can I confirm your relation with my patient, Mrs. Parker?
Yes, doctor. She is my mother. She's 78 years old.
Okay. Um, nice to meet you, Sarah. So,
Great.
I believe that you are here regarding your mother. Am I right?
Yes, doctor. I'm very worried about my mother. Like, she's so old and she's not been eating properly and she's losing weight. I just want to do something about her. I need your help.
Yeah, I can. I cannot even imagine how are you coping with it. So, before proceeding next, can I have some chat with you?
Yes, that's fine.
Yeah. So, I believe that you know that Mrs. Parker is admitted in the hospital due to weight loss. So, can you tell me a little bit more about your mother?
Yes, like since last 3 years, she has been diagnosed with dementia and she's not
Mm-hmm.
really uh, do everything on her own. I am the sole caretaker of her, and uh, lately, from last 2 3 weeks, she is not eating at all. Like she is just rejecting food and losing weight.
Mm-hmm. Okay. And so you are the only one who takes care of her.
Yes, that's right.
Yeah. So, do you manage to feed her properly?
That's yeah. I tried my best, but she's not feeding. That's what I am worried.
Okay. So, can you tell me that what happened when you brought her in the hospital in the first place?
Yeah, she was not feeding well. She was losing weight, so I brought her here.
Okay, okay. So, can you tell me, is there any other medical history, past medical history? Like, has she been diagnosed with any medical illness?
No,
Okay. And any food allergy or medication allergy?
no,
Any family history of long-term illness?
no.
Okay. So, Sarah, can you tell me that any problem with your mother's, like any problem with her gut or anything like that?
No.
Okay. And you mentioned that she has dementia for past 3 years. So, how are you coping with it?
I am just kind of like trying my best. That's all. I hope you will provide some support as well.
Yeah, definitely, Sarah. We are here to help you. I appreciate you that you are doing your best. But so, can you tell me that your mother is physically active?
She is. She walks around. Yes.
Okay. And she smoked or not?
No, no, no. She doesn't smoke.
Okay. And any alcohol?
No.
Okay. Okay, Sarah. So, according to the assessment, we assessed your mother and we did all of the tests. All of the tests are normal. So, we believe that your mother is losing weight due to her dementia because she is forgetting to take her food and all that. So we believe that the weight loss is due to the dementia. Are you getting my point?
Dementia. How can dementia? I heard it causes only memory loss. It can cause weight loss also.
Well, as dementia is a memory loss, so um, might be sometimes she forgot to take her food and anything like that. So that's why that this is the reason that she can lose the weight. Are you following me?
Oh, okay. So, what are you going to do for her then?
Well, we consult with our best um, senior doctors, consultants, and we did our best. And the consultant decided that only the palliative care is possible in this patient. Do you know what is palliative care?
No, I don't know about that.
Actually, because your mother is not feeling well and she is very weak, and because of her old age, consultant decided that uh, she does not have any procedures, so that we can in the palliative care there are team of doctors involved, team of there are physiotherapists, there are
2 minutes remaining.
there are expert nurses involved and also consultant. Okay, so we do our best to um, keep the patient in pain free, and also we do our best to give the patient nutrition while via through blood vessels or um, through the nose tube, via tube. Do you know about it?
So you are giving her. You will put tubes into her nose.
Well, actually, we gave her the fluids through the vessels, and she is managing well via these fluids via blood vessels. So now, for now, we are we decided to give her this fluid via blood vessels, and we will monitor her. We will assess her after that, and if she is doing well with this we continue it, and if not then it might be possible we will put some tube through her nose. Are you getting me?
Okay, that's a relief because I want you to put a tube into her nose because she's not feeding through my hands, and I want her to feed as much as possible through the tubes. I want her to gain weight for somehow.
Well, I can understand your concern, Sarah. I can understand that you are really concerned about your mother. So, as I already told you that she is tolerating the fluid now. So, we are giving her the fluids right now, and we will assess her condition. As we mentioned, I mentioned that there are in palliative care there are a lot of.
Move on to the next station.
Okay, doctor, what do you think?
Actually, I forgot about to ask about the daughter's what do you do for living, and how you are coping with this condition, and do you feed her by yourself, or do you manage? I think I asked, do you manage to feed her or not, but I didn't ask about her like social history, I think. And
All right. Okay, that's fine. Okay, I want to take a feedback from the doctors who've heard her. She made one biggest blunder in this station. What was that? The biggest blunder ever.
Hello.
Putting IV tubes,
Hello?
tubes and IV fluids.
NG tube.
Tubes. Okay, what else?
What else?
Yes,
This
also,
patient
I
should
think
not
this
be
was one
admitted
of
to the
my
hospital.
questions.
One by
I
one.
think this patient should have been in a way that explaining the patient's daughter about the concept of reality, that her mother is no longer eligible or appropriate to get invasive treatments. And I think NG was a very invasive kind of a procedure for this patient. Also, this is my question, what should be an alternative to NG?
Okay, we will talk about the alternative. So NG tube, blood vessels, giving the fluid. So she said that we are giving fluids through the blood vessels. She's tolerating it now. I don't know where she read that.
And she should have explained it's like what is the palliative care? It's like it means we have to keep the patient as comfortable as we can, because her condition is like is not improving, and she's at the stage where we can't give her very aggressive treatment, and it's like we will keep her as comfortable as we can. So
And I think that she couldn't explain why the weight loss is happening in her case. Is it because of her issue, or is it because of the food she is giving? So that as history was not structured as well. So yeah.
Okay,
Yeah, the
everything
feeding history. Yeah,
everything
there
aside,
was some issues
once
with it.
again,
I think
just a
I
minute,
think
sorry.
this patient should not be kept in the hospital if the patient is medically fit. Medically, there is no medical condition. All the tests are normal, so we can
Yeah.
send the patient to home.
Yes.
And there are few more things which should be considered, that the lasting power of attorney, and what are the last wishes of the patient, and what are the advanced directive, what she wants in the last days of her life. These things should be considered here in the dementia.
But that is not as important than other things, which is dementia care centers, daycare homes, which I'll be talking
Yes,
about that.
yes. Admirer nurses should become there. Means this patient should. There is no need. I think hospitalization is not must, because the feeding will not improve her condition now.
So, okay. So let me, for Dr. Samra, so the most important things that I think that you must work upon, okay, before your exam is palliative care. You need to learn more about what is palliative care, because it is not only in this station, even in the Breaking Bad news, it can come, even prescriptions it will come. You don't give invasive treatments, okay, NG tubes, IV fluids, all these things are not done. Only only enteral feeding or subcutaneous. Okay, even it comes in the prescription station, so you have to only give oral or subcutaneous. Okay, that is one thing. Secondly, in this station, it's mentioned that it's clearly written that it's been decided that invasive and aggressive management is not appropriate. So, which is also a hint that you should have followed. And another is
yeah,
that
but
patient.
actually there is in the scenario they mentioned that patient has been given some fluid and she's
Yeah,
able to tolerate. So
that
that's
is
why I
actually what
mentioned
the
through blood vessels.
oral
Yeah.
fluid, because it's oral, it's not of course anybody you give IV fluids they will tolerate. No, what will they do? So there is nothing to be tolerating in that. It's about oral fluid.
Okay.
I
Yeah.
think you have read this station before or practice, that's why it's happening. But it's a very common station, and it came yesterday only, it came in the exam, and it comes every week once or twice, and it comes as it is. Okay, just the way it is right now in front of screen. This is how the station comes in the exam. So you have to practice the station, because it might in the exam exactly the same thing. So twice. So first of all, in the beginning, it was okay. You did manage confirm the name of the patient and relationship, age. So the grips was okay. Then you asked about. Then I told I'm worried about my mother. She's old. All these things. She's not feeding well. So she did express some sympathy to that. So that's good. Then we moved on to the next. Can you tell me more about that? Okay, that was also fine. So I told you that she's been diagnosed with dementia. It's been 3 years. She's now from few weeks. She's not been eating well. So after that, your history taking starts. So can you tell me, like, in the last 3 years, like what all complaints she had, like why was she diagnosed with dementia? Okay, she had memory issues from last 3 years. Is there any improvement in symptoms or increase in the symptoms? So you need to ask the progression of the dementia. Very, very important. You didn't ask. Unfortunately,
Okay.
we do. So dementia symptoms. So what all dementia symptoms you can ask? Is she getting angry? Is she able to move on her own? Is she able to eat on her own? Is she able to maintain conversations? Okay, is she able to like do day-to-day activities? So these are very, very important questions that you cannot miss in the dementia case. Okay, because that is how you will tell, oh,
Okay.
dementia is progressing. Okay, moving further. Then you ask about medical conditions. Has she been diagnosed with any other medical conditions? Okay, any medications, any allergies? Okay, you can ask. Then psychosocial history of the daughter, as you already know that you missed. You asked a few things. So I did mention I'm sole caretaker. So you need to ask, are you getting enough support? Okay, are you able to manage your finances? All right, and who is taking care of your mother when you're not at home? All these things you should ask. So yesterday the case that comes, so one of the doctors told me that it's been this. It's like sometimes patient might tell that they are financially dependent. Sometimes they might say they need support. Sometimes might they say they are financially fine. So depending upon the situation, you will provide the support. Sometimes they may say that they need dementia support. Sometimes they may say that actually they don't need any dementia support. So if they say that I don't need any dementia support, so according to the script, don't start saying dementia care one, this, that. They don't need it. They have already told. So that is why in the history you should ask. Yesterday they told the doctor that they don't need any support. Okay, so you need to ask in the history, do you need any support? Okay, very important, these questions.
Okay.
Then moving further, you didn't explain the current condition properly. That was the most important thing that the patient wants to know. Like the daughter wants to know, how is my mother now? So you need to tell that we did medical investigation. So you better tell what all we did. We did some blood tests, we did some heart racing, we did some scans, x-rays and tummy scans. And fortunately, there is no medical cause found. You should tell them, you didn't tell them. So most probably she is not feeding well because of her condition of dementia. Do you know what is that? Okay. So do you know how much you know about dementia? You can ask that in the beginning or right now. Then she will tell it's memory loss and stuff. So you can tell, yes, memory loss is one of the symptoms of dementia. That's very good. But in dementia, there are many other symptoms. It can basically loss of many brain functions. And as dementia progresses, okay, as the brain loses its functions, people can also lose interest in their lives, and they may stop eating and stop gaining weight. So weight loss is also one of the symptoms of a progression of dementia or end stage of dementia. So we are suspecting that she is moving into end stage of dementia. So you need to clearly tell that is the diagnosis of the patient, which was not told. Okay. Then moving on to the management. So till now we have done history taking, okay, medical history, psychosocial history, and diagnosis. Now we move into the next part, which is management. What is the management? That is, so in this case, most probably, like if you want to complete the management, you should reach the management by 4.5 to 5 minutes. So you reached management, I think, quite late. So you need to take history a little more fast also. So in the management, you will talk what we have planned further. So I can understand, Sarah, that you're so worried about your mother is not feeding. So don't worry, okay? We have a lot of support available. My consultant has assessed her and planned that we can give her palliative care. You know what is it? So it is a care which is provided by a team of doctors, nurses, volunteers, social workers. And our main motive is to make sure that the patient is comfortable and living with dignity, okay? So we will do our best to make sure that patient is feeding well, patient is breathing well, patient is not in pain, okay? Your mother is able to manage your day-to-day activities. We will help in moving her around. So everything that is planned for palliative care. Coming specifically about the feeding, as that is the main issue today. So we will be, we have planned something, my consultant has planned called something called as comfort feeding. So somebody was asking what is the alternative. So it is called comfort feeding. So comfort feeding means that you have to feed her by hand. So she will say, no, doctor, she doesn't eat at that with hand. So I need to please put her tube. So that is what you, like you said, you already like told we will put tubes. That is like, that is where you lost the station. Like you totally lost the hope.
Okay.
That when you, as soon as you say that we can put tubes, you lost the station, I'm telling. So you have to tell that unfortunately we cannot put the tubes because that will only prolong her suffering. And in this condition, even if we feed her forcefully, she will only lose weight. Okay, that is your explanation for that. And instead of that, we will, and it can have some side effects. It can, food can go into her lungs and it can lead to aspiration, or even, it can be life threatening. So we don't want to force this suffering onto your mother. Instead, we will consider comfort feeding, in which you can feed your mother with your own hands, or somebody else can feed. And this will also lead to a formation of an emotional bond, okay, of love, and that will help your mother to eat much more, and it has been proven that it is much more effective. Okay, so then you talk about diet. What kind of food you can give? You can give more of liquidized food, which is easy to eat. You can give her food that is rich in calories, okay, highly fortified food. So we can refer you to the dietitian. They can make a diet plan. So that is also very important diet. All right.
Okay.
Then further moving on, in the end, if she needs dementia support, you can provide that. And regarding the end of life care and last power of attorney, you can ask those questions if there is time. But don't sometimes, these kind of questions become so big in the mind that we always try to start thinking, oh no, I have to ask this question. So we try to hurry in the most important thing. So in PLAB exam, it is not important that you have to cover everything. Okay. In my Breaking Bad News, where also these end of life questions are important, I didn't ask any, but I got like almost full marks. So it's not as important as it seems. The most important thing is that you are following the patient. If you find time, then you can ask, of course, that did your mother express any wishes, like how she wants her life to be in case this kind of condition comes in her life, because does she have anybody who can take decisions on her behalf, any last power of attorney? You can ask all these questions if there is time. And dementia care homes, even if the patient says I don't need support, you can ask her, like, are you aware of all the support that NHS is offering? Okay, then you can talk about dementia nurses, dementia care home, daycare homes, daycare centers. Okay, you can, if you are busy at work, as you said, you can leave your mother at daycare dementia care center in the morning, and you can, or daycare homes in the morning, and you can bring her in the evening, or nurses can come into your home, or there is a care homes also where you can shift your mother permanently if you want, and officials will be taking care of, team of doctors, nurses will be taking care of her at care home. Okay, that is how the station should flow. So first start with the history, first assess her knowledge, like what happened, okay, recap of the history, then as for dementia history, then mother's little bit medical background, then psychosocial history of the daughter, then moving on to the diagnosis, what is the current condition, okay, diagnosis, like we have done this, no medical cause, we are suspecting end stage of dementia. So end stage of dementia is the diagnosis. Then we move on to the management, which is palliative care. The most important of palliative care that we have to tell here is comfort feeding, and why we can't put the tubes. And the patient might ask, like, can I take my mother home? Will you keep her in the hospital? So you can take that, yes, you can take her home, you can take care of. She might tell, no, please keep her in the hospital. You say that she is medically fit, there is no point of keeping her in the hospital. If it was required, we would have. In fact, it will only put her into the risk of getting more infections from other patients who keep on coming in the hospital with different kind of infections. So you can give this some kind of reasoning. So because this is the common concerns that are asked in the exam, so that's why I'm telling you, they might ask, please keep her in the hospital. Even in the BBM stations, or some stations, doctor might assist like persuade you to keep her in the hospital. So give this reasoning. Then further talk about dementia care. So this is the flow of the structure. And empathy is very, very important in the station. Empathy, sympathy, and support to the daughter. It's very, very important. It's almost like a Breaking Bad structure, and it's a very bad news. Not almost, it's a fully Breaking Bad news, but you don't have to put in the layers because already mother is diagnosed and the daughter is aware of it. But the sympathy, empathy has to be like it's in the Breaking Bad news. Is it clear, Dr. Samra, and everybody else?
Yeah, doctor. Thank you so much.
Okay, you're welcome. So my take home message for you is that you first of all practice this station again 2 to 3 times and read about a little bit more about palliative care, and try to be follow the structures. Okay, history, take proper history,
Okay.
management. Okay, all right. Okay. Anybody else any doubts regarding the station? It's a very common and high yield station. So if you want to ask something, please go on. Okay, thank you, Dr. BT, for your comments. Okay, anybody else, any comments or any questions regarding this? Okay, so so that's it for today. So I have been mostly, I'll be doing another free mock in the coming week. Understanding of the patient, yes. So yes, that is how she starts. Can you tell me how much you know about the condition, what happened? So it's always better to start with understanding of patient, because you might saying ABC and she already know ABC, she wants to know about XYZ. Okay, so you should always start by taking the understanding of the patient and a little bit about the recap of what happened before. That makes the good start to your station. Okay, always start like that. You can even start by saying, reassuring her that your mother is feeding fluids now. Okay, that we tried giving her some fluids and she is tolerating her. That's a good news for you. So you can start on that note also. If it's in the phone call, should we tell how can I help you, or I am here to tell you about your mother's condition? So it depends. Like mostly the mother, they have arranged the appointment. So you confirm the identity, then you start by saying, I am here to help. Always start by, if there is a task given to you that there is some background knowledge is given and you have to process that, never start by saying, how can I help you? That means you haven't read the station and you don't know who is the patient. If already information is mentioned and you know how is the patient, why is he here, and what all has been done, it's almost like a follow-up. So if a patient comes for follow-up and you tell them, how can I help you today, that just means that you don't know the patient, you don't remember anything, and it's very hurtful for the patient. Okay. So whenever there is a follow-up or you have been asked to tell something to the patient, always start that I am here for this purpose. Okay. Then start by moving the history and whatever. Like in pre-op station, your task is pre-operative assessment. So don't start by saying, how can I help you today? That is not right way to start. When you already know, what is your task and why you are here today, you can say, I'm here for this. Do you have any idea about it? Can you give me a recap of whatever happened before? So that is how you should start the stations. If somebody is coming with eye pain and has no background, no information is mentioned, nothing else, mostly medicine stations, there you start, how can I help you today? Most of the counseling stations do have some background knowledge, so you make use of that. Any other questions, anyone? All right, so thank you so much for joining. So if I also do private mocks, as you can see on the slide. So all the slots in the May are booked until almost 5th June. It is 4th, 5th June it's booked. So after that, if you want to book, please let me know in advance. And I also have one-to-one mentorship sessions for which I did post in the groups a few days back, and some testimonials. So if you want to do one-to-one mentorship till the exam, that is also possible. You can reach out to me regarding that. Okay, I have one more question in the comment sections. In this scenario, can we start? I understand you are here for your mom. That's very good. Yeah, very good start. That is how you should start. Okay.
Okay.
All right. Any other questions, anyone? Feel free to ask if you want to ask anything. Okay, so we covered 2 stations today. One psychiatric approach, and second is the dementia approach. Okay, first case was covered. It has three components. One is eating disorder station, like eating disorder history. Second, it has medical history as well. Third, it has psychiatric history. So there are 3 components in that station. So you must fulfill all the 3 ones. And the second station with the dementia, it has medical history as well as psychosocial history is very important, and palliative care. So these 3 things, you should be good with that. Okay, thank you so much for joining. Hopefully, we'll see you again in next week. Bye-bye.